Hello. I hope everyone who's joined so far is able to see the screen okay. You can shoot me a note in the chat if you're having any technical difficulties or raise your hand. But welcome. I'm going to give folks a few more minutes to let them join. I generally try to start pretty promptly at 12 o'clock because everyone's gracious enough to join me over their precious lunch hour. So we'll get going pretty quickly. Okay, here we go. I know this one particular gal. Let's see if I can get here. Miss Melody, can you hear me okay? Perfect. Okay. Okay, then we will get started. Today, we are going to be speaking in regards, or the topic of the day is Sleep 101. My name is Charisse. Many of you know me. I have been a nurse practitioner since 1999. Don't ask me where the time went. I have been a fellow in advanced metabolic and anti-aging medicine since 2019. I've been practicing functional medicine since right about 2016. I'm married to the slender white-haired gentleman in the photo that you see, Steve Branch. We're co-owners of a compounding pharmacy here in Victoria, and we like to focus on foundational health. And sleep is generally a critical, if not the most critical part of foundational health. Most folks don't know if we do not have good quality sleep, consistent sleep, long enough sleep, it's our health and our weight, it's essentially game over. So I'm going to get started about on talking about this very important topic. And again, thank you so much for joining me today. So let's go here. Okay, and off we go to the races. I have a lot of slides, so I'll run through these fairly quickly. About 50 to 70 million adult Americans suffer from a sleep or wakefulness disorder. So this is a hot topic. Sleep deprivation is influenced by a lot of outside factors. Some folks, they just don't create enough space in their schedule for adequate sleep. Most folks just don't understand the importance of quality sleep, and therefore they kind of let their own sleep related responsibilities fall by the wayside. For example, we all crank about the cost of a mattress. We have to get new bedding episodically. But when you think about it, we spend 1/3 of our life in bed, 8 hours in a 24-hour day, 8 hours in a perfect world in a 24-hour day. That's a third of our life. So we need to take care of our sleep responsibilities. The moral of the story is we have to have energy to engage, and without sleep, it is definitely game over. So, what is a good night's sleep? A good night's sleep can be defined as a period of anywhere from 6 to 9 hours, depending on a person's activity level, during which 20% is in deep sleep and 25% is spent in REM sleep, rapid eye movement sleep. And we'll talk more about that later. But it's not just the quality of our sleep that matters, it's also the consistency of sleep. Try telling my 20-year-old disaster of a college student that. Scientific research makes it clear that an adequate amount of sleep is essential at any age because sleep powers our mind, it restores our body, and it fortifies every system in our body. But how much sleep do we each really need in order to get these benefits? These are guidelines from the National Sleep Foundation. Healthy adults generally between 7 to 9 hours. You can go left on this slide, and babies, young children, and obviously teenagers, they need a lot more sleep to enable their growth and development. So again, me fussing at the 20-year-old back when he was 16, maybe I shouldn't have fussed quite so much. There are plenty of other things to crank at him about. At any rate, people over the age of 65, They too need at least 7 hours of sleep. Maybe not all the way to 9, but a good 7 to 8 hours. So you need to know how much is it generally recommended for you to sleep. That's your first step here today. And then add into or factor into your own activity level and your overall health so you can get an idea of what is the goal that I need to shoot for. Again, the Sleep Foundation divides these times into 9 different groups. So let's talk about the 4 stages of sleep. We think of sleep as a passive activity. We're peacefully lying in bed, but actually our body is cycling through 4 different stages, and each one of those stages have a specific purpose. Scientists back in the 1950s thought our brain went into shutdown mode while we slept, but we now know that our body cycles through regular patterns of activity known as the sleep cycle, as you see in the slide. Over the course of one night, our body can go through these stages every 90 minutes or so. And the stages within that 90 minutes last different periods of time depending on the age of the sleeper, as well as how far into the night the person is. The first 3 sleep stages are categorized as non-REM, REM sleep, and the fourth and final sleep stage is rapid eye movement or REM sleep. At any rate, stage 1 of the sleep cycle, that's our lightest phase of sleep. It only generally lasts about 7 minutes or so. The sleeper's alert, can be woken up easily. It's during this stage that the heartbeat and our breathing slows down and our muscles begin to relax and our brain produces alpha and theta waves. In stage 2, the brain creates brief bursts of electrical activity known as sleep spindles. We see those on a sleep study. It's a sawtooth pattern when we record the brain activity during that stage of sleep, but eventually those waves slow down. Stage 2 is still considered a light phase of sleep, but the sleeper's less likely to be awakened easily. Our heart rate, our breathing, our respiration slow down even more, and our body temperature begins to drop. This stage lasts around 25 minutes. Stage 3 represents the body. What happens there is the body falls into a deep sleep where slow wave sleep occurs. The brain is producing slower delta waves. There is no eye movement. There's no muscle activity from the sleeper. As the brain produces even more and more delta waves, the sleeper enters an important restorative sleep stage from which it's really hard to wake that person up. This is the phase of deep sleep that helps us feel refreshed in the morning. It's also the phase in where our body repairs muscle and tissue and encourages growth and development and improves immune function. So you can see how critical stage 3 is. Stage 4 or REM sleep, that's what I'm going to call it. 90 minutes after we fall asleep, our body generally will enter REM sleep. It's named for the way our eyes move back and forth very quickly behind our eyelids. REM sleep is thought to play a role in central nervous system development in babies or infants. That might explain why they need much more REM sleep than we adults do. This sleep pattern is where we dream. Our brain is very, very active during this stage. Physically, what's going on is our body experiences faster and more irregular breathing and increased heart rate, increased blood pressure. But, and this is kind of weird, our arm and leg muscles become temporarily paralyzed, which stop us from acting out our dreams, right? So REM sleep increases with each new sleep cycle. It starts at about 10 minutes during the first cycle of sleep during the night, and it can last up to an hour in our final sleep cycle of the night. Stage 4, REM sleep, is the last stage, again, before the whole cycle repeats. And this stage, it's critical for learning, memory, daytime concentration, and here's our favorite, girls, our mood. We have to have adequate quality REM sleep for our mood. While all stages are important, you already guessed that stage 3 and 4 REM sleep have unique benefits. 1 to 2 hours of stage 3 deep restorative sleep per night will keep the average adult feeling healthy and restored and refreshed. But if you're waking up regularly tired, it could be that you're not spending enough time in that deep sleep phase. Meanwhile, it's REM sleep, stage 4, that helps our brain consolidate new information and maintain our good mood. Obviously, both of those are critical for our everyday life. So, what are side effects? We've all been there. We're putting on our socks on the wrong feet. We're stumbling around looking for the coffee pot. So, the obvious effects of not getting enough quality sleep is clear. As our day wears on, the effects of sleep deprivation, they only multiply. No matter how much sugar, no matter how much coffee we consume, it's still there. So there's some things that happen as a direct result of having insufficient sleep. Duh, we are more prone to accidents. Research has shown that in the United States, 20% of car accidents, 20%, what is that, 1/5 occur as a result of a drowsy driver. We make mistakes, discrepancies in our work can be due to a lack of attention span, lower energy. All of that equals lower overall productivity and job satisfaction and our ability to perform well in the workplace or in school. That's also significantly decreased. You can look at kiddos or college age students these days with their lousy sleep patterns and their cell phones. It's critical, and they just can't be as productive as someone who's maintaining a regular schedule. So this is a busy slide, so bear with me. I'm going to be on it for a little bit. Things that we see with sleep deprivation, those are obvious. Frequent yawning, irritability, daytime fatigue, reaching for the sugar, reaching for the caffeine, but there's things that we don't see. Our central nervous system is our main information highway of our bodies, and sleep is necessary to keep it functioning properly. Chronic insomnia or not getting enough quality sleep disrupts how our body sends and processes information. During sleep, there's pathways that form between our nerve cells in the brain that help us remember new information that we've learned. Sleep deprivation leaves our brain exhausted, so obviously it can't perform its duties as well. You also can find it more difficult to concentrate or learn new things. Signaling of our body, that the signals our body sends may also can be delayed, decreasing our coordination and increasing our risk for those accidents we talked about earlier. Sleep deprivation obviously it negatively affects our mood, our emotional state, our mental abilities. We can be more impatient and prone to mood swings, can also compromise decision making processes and creativity. And believe it or not, if sleep deprivation continues long enough, you can start even having hallucinations, seeing or hearing things that aren't really there. A lack of sleep can trigger those folks who have bipolar mood disorder, can trigger mania. Other psychological risks include anxiety, impulsive behavior, depression, paranoia, suicidal thoughts. We can also experience what we call micro sleep during the day. During these episodes, we fall asleep a few to several seconds and we don't even realize it. Micro sleep is totally out of our control and obviously is very dangerous if you're driving. It can make you more prone to injury, duh, if you operate heavy machinery, and make you less effective or less precise at work. Our immune system, while we're asleep, produces protective infection fighting substances like antibodies and cytokines. We use those substances to combat foreign invaders such as bacteria and viruses. So it goes without saying, someone who has a lousy sleep pattern would be more at risk to COVID. There's scientific basis behind that. Certain cytokines can also help you sleep and give our immune system more efficiency to defend our body against illnesses. Sleep deprivation obviously then prevents our immune system from building up its forces. Long-term sleep deprivation also increases our risk for chronic inflammatory conditions you see on the slide there, like diabetes, like heart disease. In terms of our respiratory system, there is a definite relationship. There's a nighttime breathing disorder many of you have heard of called obstructive sleep apnea that interrupts our sleep and lowers sleep quality. As we wake up throughout the night with obstructive sleep apnea, that also leads to sleep deprivation, leaves us more vulnerable to respiratory infections like the cold, the flu, and it can make existing respiratory diseases worse, like chronic lung illnesses like COPD. Let's see, I've got somebody in the waiting room. There we go. Here is a big one that we ladies are generally much very well interested in, our digestive system. Along with eating too much and not exercising, sleep deprivation is another risk factor for becoming overweight and obese. How does that happen? Sleep affects the levels of two hormones, leptin and ghrelin, which control feelings of hunger and fullness. Leptin tells our brain that we've had enough to eat. So we definitely don't want to mess with leptin. But without enough sleep, our brain reduces leptin and it raises ghrelin. Ghrelin is an appetite stimulant, like we need any more of that, right? So the flux of these hormones can explain why some people are more prone to nighttime snacking or why someone may overeat later in the night. So a lack of sleep can also make you feel too tired to exercise. Over time, we give up our exercise patterns, we gain weight. We're not burning enough calories, we're not building muscle mass. Sleep deprivation from a diabetes standpoint or a prediabetes standpoint also causes our body to release less insulin after we eat. And obviously, we need insulin to help us reduce our blood sugar level. Sleep deprivation also lowers our body's tolerance for glucose and is associated with insulin resistance, obesity once again, and diabetes. Sleep affects processes that keeps our heart and blood vessels healthy, including those, again, that affect our blood sugar, our blood pressure, and there's that famous word, our inflammation level. Sleep also plays a vital role in our body's ability to heal and repair our heart and our blood vessels. So people who don't get enough sleep are more likely to get cardiovascular disease. And we have research behind this linking insomnia to an increased risk of heart attack and stroke. As far as our endocrine system, our hormone production is dependent upon our sleep and sleep quality. For testosterone production alone, you need at least 3 hours of uninterrupted sleep, which is about the time that first rapid eye movement episode occurs. So waking up throughout the night can affect hormone production. It also can affect growth hormone production, which is especially important in our children and adolescents. Growth hormone and testosterone both help the body build muscle mass and repair cells and tissues, in addition to other growth functions. The pituitary gland releases growth hormone throughout the day, but we have to have adequate sleep and exercise to help that release occur. So why do so many folks have this uncomfortable sensation of not being able to sleep? Well, the first and foremost is we as a society are overstimulated. We're presented with something constantly to address. There's always something externally going on or happening, and we think we need to catch up on it. Plug into that phone, answer that message, Facebook post. We have this sense of needing to be aware of every little element of our lives, and more importantly, the need to be in control of it. That's kind of nutso when you say it out loud, right? We want to be in control of what keeps this is keeping our minds so active, not only at nighttime, but in the daytime as well. So it's just a setup for more and more folks to be suffering for sleep deprivation. So here's some of the top reasons, and most of these technology, dum-de-dum. Of course, I was going to devote a lot of time to this. So before technology, our bodies, they were in tune with the rising and the setting of the sun. The days of, quote, sleeping when the sun sleeps, those were better days. The retina, in the back of our eyes, the retina immediately detects a natural hormone, you've heard of it, called melatonin as soon as the light started to decrease. Melatonin is what helps us feel sleepy. And during a healthy period of deep sleep, melatonin remains elevated in the bloodstream. So now we think of this in terms of the bright blue light emitted by our computer screens, our phone screens, any kind of techie devices. Even what are those readers, those Amazon readers? As soon as this kind of light hits our retina, the effect of melatonin is reversed, and a state of wakefulness is promoted over that of sleep. All of this combined, in addition with artificial fluorescent lighting, has caused in our society disrupted sleep patterns big time and lowered the overall quality of sleep that we get. So what are ways to combat technology and sleep or light related issues? A lot of these are common sense, but sometimes we need them in print to actually do them. We want to dim the light on our device screen to the lowest setting possible. We want to begin dimming all of the lights in our house to send signals to our retina. It's time to wind down towards sleep. So maybe we want to start dimming our lights around 6 o'clock or so. at least 1 or 2 hours before bedtime. I tell people 2 to 4 that when they're really having trouble, turn off all blue light devices in the house. That is TVs, people, computers, tablets, smartphones. That is all geared at triggering our own production of melatonin and getting sleepiness to set in. You want to try to regulate your bedtime routine. We want it to occur around the same time each day so our body can have a regulated sleep cycle. We want to limit our brain stimulation in the hours leading towards bedtime. I tell folks to get a Big Chief tablet. Those of you who are old enough to know what that is, jot things down that you want to remember for the next day so you can release them. We do not want to watch a scary movie. We do not want to read an intriguing, scary mystery or a murder mystery. We want to read pleasant, calm books. We want to listen to soft music. Meditating is a great tool as well. That's all beneficial to our brain, helping it focus on a singular thing, saying, oop, it's time for me to be getting ready to drift to sleep easier. Charging phones or devices on our nightstand. If you are someone that has a great deal of trouble with sleep, the farther away, the better. Charge them in a different room. Get an alarm clock. Diet. This is one that we don't always think of. So just as important as fixing things on the outside, our external experiences, is making sure internally that our bodies are lined up for rest. We have actual research studies that show simple carbs, high sugar consumption, the bad kinds of sugar before bed or throughout the day is a huge contributing factor to the difficulties that we may have sleeping. Our physiology is not designed to deal with that lower mid left picture, the typical carb loaded Western way of eating. What is it? SAD, standard American diet. That is why insomnia and diet have become strongly linked. If we put petrol into a diesel engine, you know that putting the wrong fuel in the wrong type of engine has less than ideal results. And that same thing, same rule applies to us. Not only does the wrong type of fuel have the tendency to make us gain weight, but it can wreck our sleep. And with wrecked sleep, we talked about hormones already and hormone dysregulation. So it's a vicious cycle. Refined carbs, yes, that does mean white rice. Sugar, products made out of white flour like bread, crackers, and cakes are probably second to only to caffeine in reducing the quality of our sleep. So knowing a little bit about how your body responds to different foods or different drinks will make this clearer. Refined carbs get broken down to glucose in our gut. They're absorbed very quickly into our bloodstream. They have what's called a high glycemic index, which makes our blood sugar shoot up to a very high level. That's bad news for our body. So it goes, wait, I need to spill out a load of insulin to deal with this threat. And because the body has just had an emergency rush job, sometimes it overshoots that mark and we can even end up with low blood sugar. At any rate, the body's in this emergent sleep. You're not setting it up effectively to enter into a nice quality night of sleep. If we eat natural foods, which tend to have a lower glycemic index, these violent swings in blood sugar and insulin, we avoid them. So familiarizing yourself with your body and the way particular foods influence your sleep, it is very important if we're going to make progress in improving your level of sleep. Stimulants, you know this slide, caffeine. It can keep you awake and its effects can take 6 to 8 hours after we drink caffeine to wear off. You want to avoid for sure drinking caffeinated beverages in the afternoon, late afternoon or evening. I have some of my patients even mid-morning, they can only have 1 cup of coffee in the morning and then it's caffeine elimination time. Alcohol, yes, it is a sedative. It can make us tired, but it definitely disrupts the quality of our sleep. I am very sad about this. Alcohol results in lighter and less restorative stages of sleep and can leave us feel groggy the next morning. So it's not necessarily the alcohol, the chemical itself, but it's the fact that it keeps us from quality time in stage 3 and stage 4, so we don't feel restored. So I tell my patients avoid drinking alcohol within 3 hours of bedtime, limit ourselves to 1 or 2 drinks per day. Now, that was the preparation for this talk, but in reality, we all know alcohol is linked to cancers of the mouth and the throat, the colon, the rectum, obviously to breast cancer as well. Drinking even small amounts of alcohol, the American Cancer Society, we now know that even teeny tiny amounts is linked with an increased risk of breast cancer in women, because alcohol can raise estrogen levels being stored in the body, in the fat cells, inappropriately. So that's my little plug for cancer prevention. But I will tell you, for this talk, um, alcohol should be limited significantly. I would not say within 2 or 3 hours of bedtime. I would say you need to have 1 drink at the most, and preferably at 6 o'clock if you go to bed at 10 o'clock. And I know I don't even like myself saying that, so I don't blame you if you don't like me saying that. Environmentally, sometimes this is tough with kids around the house, manipulating external factors to maximize our sleep quality, but there are some things we can do. Declutter your room, clean it up, light a candle, diffuse essential oils. Again, we talked about charging your device outside your bedroom. Minimize outside noise. That seems obvious. Sometimes some of my patients do well with white noise, like a humming fan, but you get the picture. It needs to be your controlled white noise. You want to make your bedroom a sanctuary, a cave. You want to turn off your phone, buy an alarm clock, get rid of that blue light there. There is one type of insomnia I want to mention. It's a hard thing to treat. It's kind of comical. You girls will appreciate this. There is a kind of insomnia called psychophysiological insomnia. In short, it means we are worrying so much about our insomnia that we really can't go to sleep. Our thoughts are become preoccupied with the fact that we're not sleeping well. We're worrying about it. What if tonight is another night I can't sleep well? Then that means I'm not going to be able to get that presentation the next day. So we're worrying about consequences, effects, and outcomes. So we're overly apprehensive, overly analytical. Obviously, it affects females more than males because we tend to be more high strung anyway. So it's just a preoccupation with poor sleep. And it is very challenging to sleep. It's very challenging to sleep, or it's very challenging to treat, rather. So how do we boost REM sleep? Again, we want to follow recommended guidelines. Most of us need 7 to 9 hours of sleep, quality sleep a night. What are our strategies? Meditation is a great strategy. Becoming more aware of our thoughts, our tendencies, patterns, meditation supports an overall more balanced, rounded, and energized lifestyle. And studies have actually found that regular meditation can definitely have long-term benefits for our sleep cycle and can even fight against insomnia. I put a copy of a book there on the right, 8-minute meditation, because let's face it, how many of us really have time to meditate for 20, 30, 40 minutes a day? This guy that wrote the book, Victor Davich, is actually an attorney. I can bet you he made a lot more money off of this book. There's been other copies that have come out since this was originally published. You can get it on Amazon for a couple of bucks, and it is a valuable part of my practice. Not my favorite. Yes, there are sleep cycle apps on your phone. Yeah, I'm not going to talk about them too much because I'm not going to talk about them at all because I just told you to put your phone away. I really don't want your phone in your bedroom. This is more an awareness thing that there are numerous sleep cycle apps that can help you track. Their accuracy is a pretty hot debate amongst the scientific community about how can they really tell what stage you're in. But your cell phone can monitor how restful or restless and how your environment is at night. But I'm going to tell you, put the phone in a different room. Flow state. Any artist who is familiar with a deeply focused sensation of something what we call flow state, it's a state when our creative capacity is heightened. We are more intensely locked in, a lengthened state of focus. Many times it feels like we're more in tune with our bodies and our brains. And it's interesting to note our capacity, or to consider our capacity to focus, and consider that in terms of our ability to cultivate deep states of sleep. Brain waves involved in maintaining flow state, alpha and beta brain waves, they are also involved in maintaining continued and deep states of sleep. So it kind of makes sense after an intense period of flow state, kind of goes hand in hand with meditation, we can find it easier to get to sleep. Um, Sort of tied in, you also think of acupuncture benefits some folks, chiropractic treatments, therapeutic massage. So, more on food. We already talked about a regulated and a balanced diet, avoiding simple carbs. There are some foods that help promote deeper sleep more than others. Protein-rich foods rich in the amino acid tryptophan can be beneficial to those that want to improve their sleep. Tryptophan heads up the pathway to 5-HTP, subsequently serotonin and melatonin. Tryptophan is an essential amino acid. That means it's necessary for our lives, but we can't make it inside our body. So it's an essential amino acid for us to get through our food. So good food sources are a must. Chicken, turkey, milk, dairy, even though a lot of my patients, I need them to avoid dairy, but nuts and seeds are all good choices of foods rich in tryptophan. Of course, pasta, potatoes, and rice are. They help the body get the most benefits from tryptophan, but I don't necessarily want you to load up on those guys right before you go to bed, because we already talked about those are high glycemic foods. Foods with naturally occurring amino acids like walnuts, almonds, green leafy veggies, those also help keep us grounded and help us get to a calmer state and ease anxiety. Bear with me, I'm going to take a quick break to grab some water. Whew, thank you so much. I don't know where that came from. At any rate, food is important. And remember what I told you about caffeine and alcohol. Think of drinking a small cup of something with a calming effect like hot herbal tea or milk. Too much of any liquid will get us up having to tinkle too much during the night, and then it can make it difficult to get back to sleep. Essential oils are another tool. Diffusing lavender, um, that makes me think of the smell right now. Very relaxing. Other strategies. Again, a synopsis, because you guys will get these slides as well as the recording. Go to sleep, wake up at the same time every day, even the weekend. Set a relaxing bedtime routine, calming music, book, warm bath. Make sure your bedroom is cool. Your body temperature naturally decreases to initiate sleep, and a bedroom temperature between 60 67 degrees Fahrenheit is thought to definitely promote sleep. We want to exercise regularly, but we don't want to do it too close to bedtime. But my people who exercise, they sleep better. Limit caffeine. We talked about that. Alcohol and nicotine in our body can cause nighttime awakening. For optimal sleep, skip them all together. Supportive mattress, supportive pillows. Again, we spend 1/3 of our life in bed optimally, 8 hours a day, 8 hours a night. So we need to invest in that time. Make sure our bedroom is dark. Use a blackout shade, block out unwanted lights, dim the lights on our alarm clock since we're not going to have our phone in the room. Make sure your bedroom is quiet. Some of my folks really like earplugs. That has helped them. Eliminate electronics, no late night snacking, no food, preferably 2 to 3 hours before bedtime. Pharmaceutical grade supplements. Most of you on this webinar know the difference, but I'll go over them briefly. Pharmaceutical grade supplements are the highest quality of vitamins. That means they're pure, their dissolution, their absorption meet very high regulatory standards, and they are verified and tested by an outside party. They're available without a prescription, but they're typically only sold in a pharmacy or sold by a nurse practitioner or a physician. There's medical, and obviously those are the ones that I am in tune to. That's how I can expect to benefit my patients if they use pharmaceutical grade supplements. Medical grade vitamins are also a high grade vitamin, although they, believe it or not, they may not meet all of the standards that pharmaceutical grade vitamins do. Usually the prenatal vitamins, those samples that we get in a nurse practitioner or doctor's office, usually fall into this category. And then there's cosmetic or nutritional grade supplements. Those are the ones that are usually sold in health food stores or in pyramid chains. I can't say names, but somebody sells this and they have another person selling underneath them. These supplements may not always be tested for absorption or purity, and they may not always have the same concentration of active ingredient as what is listed on the label. Big box stores and Amazon, just don't do it. It's a waste of your money, especially in my patients who we may need them to be gluten-free, or they may be, I have one patient, she's allergic to corn. Well, these things are used as fillers, so she has to be very, very careful. That's why another reason you want a pharmaceutical grade supplement. And what are some supplement considerations? Magnesium glycinate. These are all four of these are things I use in my practice. For folks who are not on an antidepressant like Prozac, Paxil, Lexapro, Effexor, they may be a candidate for 5-HTP. But let's talk about melatonin briefly. With kids and adults alike, I like to start with a low dose and work up to the minimally effective dose. And with melatonin, the most effective dose for most people is established, believe it or not, at 0.3 milligrams. There are plenty of studies using just children as subjects that use pre-bedtime doses of up to 12 milligrams, and that's in kids. But there seems to be some latitude in dosing in the children arena. As a matter of fact, there was even a trial done with newborns that showed favorable study outcomes when those newborns were given 20 milligrams of melatonin. So there you go. I get a question often, does the use of melatonin over time reduce the natural production of melatonin? And that's a great question, but the answer seems to be no. We can increase our own melatonin production nutritionally, as we talked about in the other slide, by feeding the body the amino acid building blocks to make it. Supplementation with melatonin will boost both your blood levels and your urine levels, but it will not change underlying endogenous production. That means what your body makes of melatonin. So that means you take melatonin for a period of time, then you stop it. Your body's melatonin production will go back to the pre-treatment state. Melatonin does seem to be safe long-term. There are a few studies that show it loses its effectiveness over time. There are many other studies that demonstrate its safety and efficacy over many years of use. So there you have it. Light and dark stimulation are the greatest feedback mechanism we have to the pineal gland, P-I-N-E-A-L, and that's where melatonin is made. So other people will ask me, so back to 5-HTP. HTP is a precursor to serotonin, okay? You saw that on the other slide. So many people will ask me, what dose of 5-HTP do you use to help people to sleep? Generally, 100 milligrams is an excellent starting dose, but patients, it's a great starting dose, but people usually need a little bit more to get a little bit more of a clinical effect. 300 milligrams at bedtime is generally the sweet spot that I see the best results with my patients. I do have a few people that don't respond to 5-HTP at all, and these folks usually do better on tryptophan or melatonin itself. Just remember, if you're on an antidepressant, you always want to check with your provider to go over your prescriptions. People who are on Lexapro, Paxil, Prozac, serotonin reuptake inhibitors, if we give them 5-HTP as a supplement on top of that, they're at greater risk for something called serotonin syndrome. So you have to be very careful. You have to be careful with that. You can't just, supplements too are just not meant to be taken randomly. I had a patient send me this. When we talk about, we all have different sleep hacks. Fish oil, she takes fish oil at night. She doses her fish oil at night, which the majority of us, actually 100% of us on this call, this webinar, need fish oil. She takes her fish oil at night with a teaspoon of olive oil after she has her warm bath. That is her personal sleep hack. Both of those are inexpensive options, and both of those support serotonin uptake. So everybody finds what works best for them. I talk to patients every day. Steve does as well about test, don't guess. This is an example of 2 saliva tests we use in our patients that have trouble sleeping. You see on the right side, the primary one is that salivary cortisol. Yes, we need our sex hormones balanced as well. Many of you know my perimenopausal and menopausal females are low in something called progesterone, which I have on this slide. You can see estradiol, progesterone, and testosterone. Many of my middle-aged gals need some supplemental progesterone that can help with sleep at night, and they definitely need cortisol management. You can see that cortisol pattern there on the left. You see that elevation. Without a fact, this person, probably a female, is fight or flight syndrome deluxe. She's high in the morning, she stays high at lunch, she's stressed out and geared up evening wise, and she is still that way before she goes to bed. This person is not getting to sleep easily, if at all. Cortisol steals sex hormones, for lack of better words. That's a simplistic way to say it. Our hormones complement one another. Sometimes they function as opposites. We have to make sure estradiol, progesterone, testosterone are present in the right ratio. During chronic stress, like that gal who I showed you, her cortisol picture, our body is obviously pumping out more cortisol for her. To make more cortisol, our body has to steal from our sex hormone system and use our lovely, natural, calming, occurring progesterone to keep cortisol. So that makes sense. It becomes a difficult cycle. That's why so many of my ladies do better with sleep when we work on them with their stress levels, working with nicotine, alcohol, and most of them, if testing indicates, need their progesterone supplemented. So you test, you don't guess. So as a synopsis, HCP stands for healthcare provider. Have your provider review with you your lifestyle, review your medications, review your supplements. In some folks, the little tweaks we discussed, if that does not do the trick, those folks need testing, not guessing. And many folks do need pharmaceutical grade supplement support. You may be one of those. You may have additional questions. That wraps up a very long sleep webinar, and I apologize for the length. There's just always a lot to talk about. So I'm going to open things up for questions. I'm going to open things up for questions. Please shoot me your questions via chat, because I am happy to answer questions. Let me get that off of there. What type of magnesium to take? The ladies in the back of the pharmacy in the lab they were asking me this last week. Magnesium, there are many types of magnesiums, and that can be very confusing. Do not waste your money on magnesium oxalate, OXALATE. It is poorly, if at all, absorbed by our body. We use magnesium citrate in the pharmacy in my private practice a lot. There's magnesium glycinate, there's magnesium threonate. Generally for sleep, we like to choose, and you can refer back to that other slide, magnesium glycinate. Some people 200 milligrams at night. Sweet spot for a lot of my people are 300 or 450 milligrams. You can go up even higher if someone has checked your blood level, your what you call intracellular level of magnesium. At any rate, generally the most calming magnesium to enhance sleep is magnesium glycinate. Some people say magnesium glycinate. Any other questions? quiet lunch crowd. Again, I will send out this recording to everyone. I can also send out a supplement sleep protocol for you to look at and shoot me questions as well. And I know, and I'd already promised to send out a recording because some folks had contacted me beforehand as their days plans had changed. I'm not going to make it, so no worries. Here we go. What's phosphatidylserine? Phosphatidylserine is a fatty, it's a phospholipid. It's a fatty substance that covers our nerve endings, our nerve cells, our brain cells. We do have studies. We use phosphatidylserine as a supplement for memory loss, enhancing cognitive function and concentration. I use phosphatidylserine in my practice when someone's cortisol level is high. For example, the slide here, let's go back here. Oop. That's not good. How did I do that? Hold on. Let's try this again. If I can find you that slide. Let's go here. It's a miracle I was able to pull it up more. Okay, you see that salivary cortisol there on the left, the gal that I told you, I'm guessing she's female. This is a patient I would use phosphatidylserine in. You would say, well, Sharice, do you use it at morning or night? Because she is hepped up throughout the day. I would start by using 300 milligrams of phosphatidylserine in this patient at night, and probably use some other tricks or hacks for her elevated morning and afternoon cortisol. But I would start with phosphatidylserine at night for this patient. Any other questions? There we go. Well, I encourage you to look back over the recording, look back over the slides. If you need additional help, Steve's always available for a pharmacy consultation over at Central. I'm over here across the way for an appointment or a quick question. Just shoot me your questions. We definitely want to be a resource for our community's foundational health. And again, as I started with, if we do not have sleep, it's game over. There's no way we can maintain our weight and have a robust sense of vitality. You saw on the one slide, sleep impacts almost every body system there is. So we have to be very protective and very proactive about quality sleep. Thank you very, very much. I'm looking at once again. No more questions.
Thanks, Sharice.
Oh yeah, I forgot to turn the video back on. Let me turn it back on. Shame on me. There we go. At any rate, thank you very much for coming. I appreciate it. And I look forward to hearing some questions from you guys. You take care, okay?
Thank you.
Thank you.
You too.